Swan, for being here. Yes, sir.
How's everybody doing? I thought I might give you all an update. It's not about COVID. The state champion 8U from Clemson Central is crushing it right now in the World Series. 2 wins away from a World Series championship, and the 12U boys are doing the same thing. It's really, that's what I've been doing out there. They're playing right now.
Thanks for the update.
Okay. I'm glad to be with you guys and appreciate the invitation to give you some thoughts. I know you have a lot to talk about tonight, so I'll try to keep my comments brief and answer questions that you have. I was on vacation a couple weeks ago, and everything was great. Having a wonderful summer, masks off, no problems. Got a phone call from the lab at Clemson that we'd seen the highest viral load that we'd seen in 450,000 tests. And we knew that Delta had arrived. And so the Delta variant of the coronavirus is what is happening all across America right now. This summer we got to see it show up in other areas of the country first, and it is finally kind of landed on our doorstep. As a family physician, a community physician, talking to patients, you know, a lot of people get their information from different sources that are distant from their home. Well, the lab that we have in Clemson gives us access to information about our community that you know, I think it's pretty special. And so the things that we get to share are things we see here in Clemson, not what we're hearing from other places, but we have data here. So I sent Andy some slides this evening. This, if you can see the graph, I've got circled in pink. This is over the life of the pandemic, the different surges that have occurred. The one in the middle was this winter with the UK variant, more contagious. You can see what happened with the more contagious variant. Early in the surge, what you really look at is the acceleration as cases go up. How fast do they go up? And right now, you know, you can see over there on the right there, things are just shooting up. So this is confirmed cases in South Carolina. I'm going to scroll up to the next slide. One of the things about COVID and one of the things about Delta and about the benefit that we have from what I call partial immunity. We have many people in the state who are immune, who have some immunity, some by natural infection, some by vaccination, some by both. But and a large percentage of our most vulnerable neighbors are vaccinated. About 77%, I think that's right, 77% of 70-plus-year-olds are already vaccinated. And so the hope would be that those vaccines would be protecting them from a serious disease that required hospitalization and ultimately death. And so I've got circled over there to the right, this is the average number of deaths occurring over the summer. And while we're seeing, we're in the middle of a surge, we don't yet see any rise in deaths. And so that's excellent. Unfortunately, sometimes deaths don't occur right away. You know, we had a death on our baseball family this year. A grandmother of our center fielder died of COVID. She passed on the opportunity to get a vaccine, but she was on a ventilator for 4 weeks before her death. And so deaths don't show up immediately when you look at these graphs. So let's go to the next one up. This is the number of people that are actually hospitalized in the state. And I kind of think this tells the real story of COVID, because we have a lot of people who are young and healthy that might get sick but won't get very sick. But if you're sick enough to be in the hospital, you know that it matters to those people. And so most people who are hospitalized probably would have benefited from a vaccination. We know the CDC says that people who are vaccinated are 99.999% not going to have a hospitalization or a death from COVID. And so when we see these hospitalizations, we know where that is coming from. If you go to the next slide, this is who's on a ventilator. And so both the hospitalizations are going up and the number of people on ventilators. That data looks a little bit different than the rest of it to the left, because DHEC has changed how frequently they report who's in the hospital. So it's weekly instead of every day. So it looks a little bit lighter, but those are the numbers. And I was fortunate enough to talk to Jane Kelly, who's the assistant state epidemiologist for DHEC last Friday, trying to get an idea, since they're not showing us all the information that I like to see regularly, kind of what she's seeing. And they're observing exponential growth in all these problems. And tomorrow is a day that we'll find out the latest hospitalization data, who's on a ventilator. And also, we just closed out the month of July. And so they're gathering important information about breakthrough cases, people who've been vaccinated, and people who have passed away even though they have been vaccinated. We're going to get a chunk of information for July in the next couple of days, hopefully, that will be very meaningful to everybody who's done all that they could to survive this pandemic. In June, in South Carolina, we only had 2 people die who had been fully vaccinated. And both of those individuals were told to me they were fragile to begin with. They were already in poor health before this occurred. And so we know that the vaccines are protecting people from serious hospitalization and death. Let's go to the next slide. All right, I'll pause there. So let me tell you about what we're seeing in the Clemson lab. We are seeing plenty of breakthrough infections. And what a breakthrough infection means, someone who has been vaccinated that tests positive for COVID. We've also seen in our community evidence of a person who was vaccinated, became sick, and was able to then pass that infection onto another vaccinated person. So that's important because a vaccinated person then transmitted the illness. These are all just very frustrating observations and disappointments for many people in our community who have taken the effort to be vaccinated. On the other hand, we have a couple of examples where we've had people who've been sick, unvaccinated, and their spouse in the same house who was vaccinated did not get sick. And we have the ability to kind of peel back layers of the onion in the lab and examined a couple of these cases very closely. And this person who had a Pfizer vaccine continued to show absolutely no evidence of infection. So in that case, that person was covered by the benefit of their vaccine. We had a death last week in a Clemson resident, one of the people that came through our testing site, 53-year-old who had some other risk factors. Today, I talked to most of the people who tested positive today. More than half the people that tested positive today were vaccinated. Of the ones I talked to, all but one were having very mild illnesses. They tested because they knew something wasn't quite right and they wanted to do the responsible thing, and they found out that they were positive. The one person who was more moderately ill was 70, but even talking to her, it sounds like she's going to do well. Let's see. Let's go ahead to these slides. So that is what's happened in Pickens County over the last couple of days, reported by DHEC. The cases are going up, so we're seeing the same kind of growth that we're seeing in other parts of the state. Maybe not quite as tall, but it's kind of like it's coming. A little bit of a matter of time. The next slide. This is when we have a lower sample size because we don't have just the thousands of people coming to our test site. But these are people who tested positive over the month of July and today that came through our site that do not have an address that I call the Clemson community. So we've had to define a border of what that is, and I call that Clemson Central and Pendleton, just for the purposes of this. And so these are the number of people that have come through positive outside the community. And then the next slide is the number of people that have come through. The numbers don't match up. It's a lower amount, but you can see the little bit of the trend. Nothing really was happening significantly in early July, and that's changed. The next slide puts both groups together. The blue, the darker blue is Clemson. The light blue with the green trend line kind of gives you the idea of maybe the acceleration that we're seeing, and that certainly matches what we're seeing in across the state and in other states that preceded us. I think we've been giving vaccines out of our office and out of a community vaccination effort It's encouraging that with some of the news of Delta, we're hearing that more people are signing up to get vaccinated. I've had several phone calls over the last week. And I've personally tried to reach out and try to soothe and guide people through the decision to be vaccinated. And it's not an easy decision for a lot of people. For people, there's kind of some people that were ready to jump immediately. And if you're one of those people, it's very hard to understand why somebody has not yet chosen to be vaccinated. But there's a lot of people who've given a lot of thought. Many people have taken kind of a wait and see approach, wanting to make sure that everything looks safe. So my message is to people who've taken a wait and see, we've waited long enough, and so now is the time to be vaccinated. It really is, covers your threat of hospitalization and death. We have, unfortunately, enough vulnerable people in our community who've yet to be vaccinated, despite the opportunity to do so. Our test site is awesome. This city and this community is unbelievably blessed with the resource that we have for free testing, accurate, timely, super convenient. You don't have to have a Q-tip shoved up your nose. And so as I was thinking about what I wanted to share with y'all tonight, maybe if I could get your help doing one thing, I want to make sure the community knows that this test site is there. And maybe we could share that message a little bit more, because there are a lot of people that know, but I think there's probably some people that still may not be aware of it. And some people who've not dealt with any symptoms of COVID are all of a sudden about to, and I want to make sure they know that this is here. A fun part of being in a university town is you get to study things, and we have retrospectively looked at what happened with our testing during the winter surge, and we've been able to demonstrate that Clemson exited the surge sooner than other communities, and we think that timely testing had a lot to do with that. So it's just really a blessing, and we want to make sure all of our community members know how to take advantage of that opportunity. Also working on getting that opportunity on Saturdays and Sundays also. So I'll communicate with you all about as that firms up. Just a word on masks. There's masking, the use of masks in preventing COVID has been a really contentious issue throughout the pandemic. To a large degree, there's not the kind of evidence that we would love to have, where somebody could just say, there's a randomized controlled trial, we have the hard proof that this is how you do it, and it works in these situations. We just don't have it. But there are people who have been able to investigate, and the balance of the evidence suggests that masking makes a difference. However, it's not as solid as we would like. What I can tell you is that some masks probably don't make much of a difference. A cloth mask made out of a t-shirt is probably not going to do anything. The N95 mask that I have, if I'm a case study of one person, has absolutely worked. And I put myself in front of a lot of sick people, but I've not done it knowingly without this mask on. And thankfully, so far, it may not last, but so far, I haven't gotten sick. And so a quality mask can protect somebody. One of my messages to people who have chosen to not be vaccinated is, if they're willing to take the risk themselves to be sick, that's kind of their business. But I don't want them to spread it. And so if you're committing to, if you're hell-bent on not being vaccinated, they should be hell-bent on not spreading the illness. And so a mask, a good quality KN95 or N95 mask, can do that. Another nuance about masks, we think that we see the degree of illness that somebody might experience might have to do with the exposure to the virus if somebody coughs on them or they walk into a room. If you breathe a whole bunch of it in, you get a whole bunch sick. If you breathe just a little bit of it in, you may contract the virus, you develop antibodies, but maybe your illness isn't that bad. And so anything that creates barriers that might reduce some of the viral, the amount of virus that somebody experiences could be helpful. So I think masks can do that for us, and I'm happy to take your questions.
So do you think we need to go back to at least considering some form of a mask ordinance at some point or no?
Yeah, I think that the decision about ordinances is really your business. Medically, I can tell you that they work. Well, let me say, medically, I can tell you that my opinion is that they work, and that the evidence that we would like to have is lacking for some, and that's an argument against doing something like that. I will tell you that I think the moral imperative for a business owner to make a change in how they're putting a mask on, having masking that impacts their business, and I don't think it's the same as it was this time last year. I think the fact that people have had the opportunity to be vaccinated, we know they work. If people forego that, I don't think that's something that we should ask somebody to sacrifice their business. It's just different this time. So I do believe that a good mask makes a big difference, but I think you guys have to think about the setting and how things are different. We've got a vaccine is 1,000,000 times more effective than a mask, and everybody in America at this point that's eligible has had that opportunity. So,
do you think there are things that we could be doing that we're not doing that would increase the vaccination rate?
I think it's been difficult, the different messages that individuals have received. It's been just a challenge of the pandemic. It's been like a whole other kind of infection. And so I think in Clemson, we've just been so fortunate to even be presenting here, sharing information with y'all, you guys being interested in wanting this, and having on the ground, what's it like in Clemson? We know we can talk to that. I wish that happened in other places. So I think in Clemson, we're doing well with that.
So a lot of people look at the wastewater and just copies of the virus into the wastewater as I understand it. With the Delta variant having a higher viral load, does that change those numbers? Or like, how should we look at the numbers?
So Dr. Friedman will have the best answer, but my understanding is that we may see more viral copies in the wastewater from Delta that this time last year would look like just more individuals infected. But it might be just that it's that much more virus being shed from an individual, from a group of individuals. So it would be appropriate to get him to comment on that because I don't want to speak for him. But I do think that's an open question. I haven't heard the answer.
With children under 12 that aren't eligible yet, what's the data and what's it looking like so far with Delta, and is it about the same as it's been before with the effect that we're seeing in younger kids that are not yet eligible?
So we definitely see transmission from children, and I have two of my patients today tested positive, and we think it may have been their granddaughter, and I think she's 5 or 6 years old, who had one day sneezing. So we know that children can spread the illness. As far as how sick they might become, everything that I'm aware of is not showing any meaningful difference that children are going to be sicker with Delta versus others. I want to say that I don't feel like I'm informed enough to make a definitive statement on that. That's a very important thing if that was happening, but I'm not aware of that.
But we'll probably know more in the next 2 weeks.
We'll know more in the next 2 weeks for sure. I will say I was frustrated. I got boys are starting school again tomorrow, and I think that schools should be encouraging students and staff to wear masks. They cannot require it, but there is no reason why they cannot encourage it. And so the email I got from Edwards Middle School today just remarked that masks are optional. It didn't say we strongly encourage our students and staff to wear masks. But if you don't want to, we respect your decision. So that messaging, everybody has a role to play. In our office today, we went full on masks again, regretfully so, with an upside down, smiley face. And one last comment about the conversations I had with those that tested positive today. I spoke to 8 of 9 positive people, the 9 positive today, and 6 of them had no idea where they picked it up. So they don't know where they got it. And 5 of them were vaccinated. And so it's out there, and this thing's shooting up like a rocket ship. I don't know that a good mask, I don't think a cloth mask can do a lot to stop it. I think a good mask worn the right way can help an individual. I think it's different this time around than it was a year ago with how we should act. I would like to encourage certainly business owners and pastors to be very thoughtful about the environments that they create, because you can have spread in a family where one person shares it with 3 people, but you can also have settings where one person can give it to 25 people. And one of the hallmarks of Delta, and I didn't mention this, is it is significantly more contagious than earlier versions of COVID. And the hallmark of COVID from the beginning was how contagious it was. And so the mitigation efforts that seemed to be successful previously, they may not be enough. And then the last thing is, to a degree, I'm optimistic that this is going to come. I think it's going to come hard, but it also might come fast. MUSC has been tracking estimated immunity, thinking that about 63% of the state has some kind of immunity to COVID. And Delta is coming so hard and so fast that the people who have decided not to take multiple measures of protection are very, 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 very likely to contract it. And so 6 weeks from now, 10 weeks from now, we might be in a different situation. In India, when Delta shot up like a rocket ship, once it peaked, it dropped off a cliff just like it went up. And so we'll just have to see what happens. The indicators that we are seeing certainly should have our attention. And my hope is that some benefit of partial immunity in the number of people who are vaccinated and the people who take individual precautions will keep us from just the ultimate tip-top peak. So time will tell.
Thank you, Ted.
Questions, comments? Dr. Swan, we greatly appreciate the update.
Yep, thank you. Appreciate it.
Thorough research and the data. Thank you, Andy, for coordinating this.
I also would just like to thank each and every one of you for the support that you've given, the opportunity to share information like this, but the city for hosting the registration link for community testing, the support that you guys, each of you came out and supported our community vaccination effort. So it's real, I just really feel like it's a wonderful being a part of the community together. I appreciate your leadership. So thank you.